All right, welcome to the introduction to using the Sonosite XPorte. A couple of things to note the way it's set up currently with infection control. We've removed all ECG leads from the sides. There's just a curved array transducer at the front, a linear array and a phased array. Power cable is currently tucked in the back, but we've got no other equipment in the bin. If you're going to an infected area, it's often important to remember to remove the gel bottle. So gel bottles must not go into infection prone areas. Instead, if you take gel from the bottle and place it into a tub before you go in there, then you can have gel that's non-infected. So bottles never go into the infected area. Pre-using the machine, we'd recommend a wipe down with Clinell wipes, detergent wipes, to clean the transducers, cables and the machine itself. They're non-damaging to the machine and are much more effective and safer than alcohol swabs. To turn on the machine, there's a power button at the side. It typically will turn on relatively rapidly. To adjust machine height, you can press on the foot pedal on the bottom, which will allow you to move the machine downwards or upwards to a comfortable height. The screen can articulate towards you if you find that easier for typing. In terms of data entry, we recommend 3 identifiers to be placed. As you touch the first one, you can enter their first name, last name, their date of birth, and their ID number corresponds to their medical record number. And usually I recommend doing some relative indications on there, be it a trauma scan, be it a lung scan, just something to remind you when you later look at it what the indications were. So be that institution is unchanged, department ID is unchanged, user you may use, but more importantly, due to DICOM tagging, the referring doctor is the important screen to fill with. In terms of what you fill, I use my initials. It's also reasonable to put in your name or your employee number. They'll be easy to track, and it means that you're less likely to have duplicate initials from someone else within the department. So you've entered the patient data. This is typically preferable before you go into the room, and then you can choose the transducer that you want. So to choose the transducer, press transducers and exams. You've got a number of different probes and presets. For this purpose, we're going to talk you through a lung, and this customized preset will be here. To further confirm that it's a lung preset, it should say on the top screen. So if we look on the top screen there, it says that it's on lung 3, which is our customized preset. Going back to the transducers, I think an early mistake that we made was to touch the transducer itself. That will select the exam, but it won't tell you which exam. You could be ending up accidentally on any of them. You often need to touch the preset twice to make it activate. Then you will perform your scan, so you'll do a systematic exam. Once you've start at the beginning, you'll optimize your depth, focus and TGC. In terms of a Sonosite, the focus always remains optimized for the middle of the screen, so there's no need to adjust focus. To adjust depth, you can move the scroll marker down the side. And if you need to touch TGC, this is overall gain at the bottom. And thereafter, you've got an option to adjust your far field gain or your near field gain and bring them together for that. For labels, we've got an automated set of labels. So once you've decided where you're scanning, you should, in this case, it's been customized for lung. So you can just literally press here, and if we go R1, that will customize that. Press done. And then R1 will appear on your screen on this bottom right side of things. If we were saving a loop from there, the loop occurs at save video clip. A save image without freezing is here, or if you were to freeze, it'll freeze an image and you can then save the image. Another option to unfreeze is to use a double tap with 2 fingers, and that will unfreeze the image and you can continue to scan. If we moved from zone R1 to R2, literally just press the icon and the write on paper button. I remove the R1, press R2, and then we're done. And hopefully, as you see there, it corresponds to R2. We'd then save a video clip of that zone. And as you hear, the 2 beeps correspond to the beginning and the end of the recording, which is done prospectively from the time you set it. We'd then continue the exam as we would normally do. I'd typically go to zone L1 then. We're going to record a video loop, and we've heard that that's completed. We complete that to complete all the zones that we particularly want to scan with the lung, making sure that if we're looking in around COVID that we emphasize zones 5 and 6, which we previously didn't tend to perform that commonly when doing lung exams. Once we've completed our examination, we want to perform a report. You can either do a report based on a review of images that you can look at here, but most of the time you will have decided things before you get there. So you can go straight to worksheets. There are some preloaded worksheets that come with the machine. However, we have customized a worksheet for lung which you need to scroll down to, and it'll appear here. For simplicity, it's relative tick box, relatively little text. So if you scanned zone 1 and you saw lung sliding but no beep profile or consolidation, you just tick A or A profile, and so on put through R2, L1, L2, R4, L4, and L5, L6, R5 and R6 until we get to the very end of our report, and you can give a summary and a little free text should you need to. If you need to add, it's got to be concise, because unfortunately with this machine, if you go to the second row, you'll end up creating more text than will be recorded as the image, because it's only what you see in front of you that records with the images. To save that, it's important to save images, not to save image. If you just save the image, it's just what's on the screen in front of you, whereas if you save images, it's the whole report. So we save images. Now we've got a full lung scan with saved representative images of each zone, along with our conclusions and report. Once that's done, we can then end examination, which is done at this bottom side here. And it'll give you a warning, do you truly want to end this exam? And we do. And that is the end of a rapid startup guide to the Sonosite. In terms of cleaning, everything will be cleaned down and wiped up, again using Clinell wipes. In a separate video we'll try and talk you through how to do cleaning. Thanks.